No two parents have the same experience. No two children with the same heart defect will have the same recovery period either, so it's very difficult to generalise, and you have to say, well, some babies will recover in this amount of time and others unfortunately will stay in hospital for longer. After surgery, all babies will be going to the intensive care unit, and it's a very daunting place with lots of tubes and wires. But as the baby or the child gets better, gradually these tubes and wires are removed and the child will move through the process of recovery, and they'll move to the children's heart ward, which then is preparing for home. In the case of a baby, it's establishing feeds and a child getting back to their normal routine. Parents in that situation are terrified at the thought of taking a baby home post-surgery, and it's the job of the nurses to prepare them for that, to tell them what to expect, teach them how to give any medicines that need to be given, and be there as a general resource and support for them when they do go home.
Wound care is something that parents always ask us about, and the important thing is preventing any infection, and that if there's any change to that scar line, any redness, any exudate, anything that just doesn't look right, then their GP or their local A&E department should review it and make sure that there's no underlying infection.
Most cardiac units will have a cardiac liaison service or an outreach service, so they have contact details of experienced cardiac nurses who will give them advice and support on going home, and if they're not there, then they can always ring the ward, and you know, this is a universal policy really, so they shouldn't feel worried about going home.
We often hear the parents saying when they get the children home that they're full of energy and they're hard to hold back. Now, we do encourage the parents not to mollycoddle the children too much, not to wrap them up in cotton wool too much, to let them get on with life and to be active and to be participating in running around with their siblings, their other children, and other brothers and sisters, or their school friends.